Director of the American Parents Coalition. How you doing this morning, Allie? Welcome.
Uh, I'm well. How are you?
I'm great. Tell us about the American Parents Coalition and your mission and what it's all about, and then we'll dig into all the conversation with Thune and the various other Congress critters, about this issue you're pushing.
Sure. So we are an organization founded to reclaim parental authority and also defend parental rights. We believe very simply that it is a parent's job to raise our children, and we are not prepared to surrender or compromise on those rights or influences with any institution or other organization.
Okay, good for you. In other words, you wouldn't be putting up with Oregon schools, as an example, secretly gender transitioning your child without telling you.
Absolutely not.
That kind of stuff.
Absolutely not.
All right. Okay. Yeah, that's been a big battle around here. It is astounding how the leftist cabal thinks that it may be your child legally, but we've got the kid all day, right? That's sort of the struggle where you find yourself these days, isn't it, in the system?
It really is. And we have a lot of resources actually on our website. If any of your listeners, I know we're going to talk about something else, but AmericanParentsCoalition.org, if anyone needs resources on how to have those conversations with their schools and just like where to start, we've got some good information on that as well.
All right. So let's talk about that. What your bone of contention right now has to do with medical transparency and clear upfront pricing. Now, I've been led to believe and talked with other people over the years that law says that we're supposed to be able to see on a website or very clearly how much procedures cost. And that's for everybody. And yet, I don't think it's happening yet. Am I right about the law for one thing, or is it still about the rules being implemented? Set the table of what's bugging you.
Sure. So in President Trump's first administration, he used some existing law to mandate price transparency, and he established that via rules out of HHS. So where there is an issue, where issue can rise, is it's really based on enforcement. And the Biden administration was light on that enforcement and rolled back some of the requirements. So there is an infrastructure in place for price transparency, but what we really need is for it to actually be codified into law. And so we recently sent a letter to the Senate encouraging them in whatever healthcare legislation they put forth in the next few months to make sure that price transparency is included. And we go through the many reasons of why that is so important and how it is just an odd thing to expect people to show up with a blank check and a credit card and say, oh, here's your bill, after services have been provided, without the opportunity for families to be able to shop around.
So if I understand correctly, what I'm hearing then is that these were executive orders or these were rules rather than being an actual law. Is that fair? Is that what we're talking about then?
That's right. And there is a bipartisan bill before the Senate right now. It was authored by Senator Marshall from Kansas and Hickenlooper from Colorado, mandating price transparency, but that just hasn't gone anywhere yet.
Okay. Well, we need prices. In fact, you're actually calling this patients or parents in this case, because you're advocating for parents' rights, right? It would be parents need prices, right? That's what you're calling this?
That's right. Parents need prices. And it is a pillar of the president's great healthcare plan. And so we're just encouraging that gets over the finish line. I mean, we wouldn't ask families to show up and buy a vehicle. You go out onto the site, you test drive a vehicle, you drive away, and you've got it parked in your driveway for 4 days, and then all of a sudden you get the bill. You have no idea what the heck it costs. This is a rare thing where in the healthcare industry, especially once you get into an emergent situation where you just show up and you're in need of treatment, and you're just required and expected to pay the bill. And there's no opportunity to shop around. But what we're finding too is that it really affects, of course, a family's ability to financially plan, and it can make health outcomes a lot worse because parents may forego that routine or maintenance or preventive care for their families and specifically their kids because they can't afford those routine visits in addition to what may be an emergent situation. And so it becomes a a decision for care based on finances instead of based on needs or prevention.
You start thinking then as a parent that you're rolling the dice when you're going to the doctor, right? Well,
Exactly.
little Tommy or Susie needs something, but I don't know if we can afford to roll the dice on this. And so you avoid getting treated for that reason.
That's right. You may put something on the back burner that you think is mild, like an allergy or a rash or something like that, and treat it over the counter. And then over time, it gets worse, and then you may find out that it's an infection, or it gets infected, or it's bacterial. And had you been able to go up front and speak with a provider or several providers about this, because you understand, okay, it's going to cost me X amount. These procedures and these appointments are readily available on a database. I know if I go to my pediatrician, it's going to cost me X for this appointment.
Yeah.
But that just doesn't exist.
And why doesn't it? Why is there such resistance to this, you believe, Alleigh?
Oh, well, everybody's got their theory. I think a lot of it comes down to just good old fashioned who's gonna make some money on it. And right up to this point, no one's really held their feet to the fire, whether that be drug manufacturers, insurance companies, life insurance, whatever it is. Everybody's got a stake in this game, and I think they're going to just milk it until they absolutely can't. And it's the role of organizations such as ours to listen to the parents who are talking to us about how difficult this issue is in providing for their family, and to do our part to help hold Congress and lawmakers' feet to the fire on getting something done.
The medical folks will say, hey, you got to shop around, but then you try to shop around, and then what do you have, right? That kind of thing.
Yeah, I mean, you truly can't. You truly can't shop around.
I wonder how much of this could be. I wonder, could insurance companies be driving some of this lack of price transparency, because they end up cutting special deals that only they get with the doctor and or the hospital system? Could that be one of the reasons everyone's dragging their feet, and they don't want it known that Providence or Asante, the local hospital groups here, might only pay, maybe they're only paying $250 to the insurance company or whatever it is, but they'll be charging you $350 for a procedure if you're cash. What do you think? Any possibility?
I think that's certainly part of it. Of course, hospital systems have their own pricing structure. Different providers have their own insurance companies with what they will and will not cover. I mean, you could go to the hospital and receive X treatment. Your neighbor could go and do the same thing. And if you have different insurance providers, even just what they are billed is different, let alone what ends up making its way back to you in the mail. And there are 100 million Americans in medical debt right now. It's the leading cause of personal bankruptcy. So this is not some fringe issue or something that's, just people looking to complain about something because there's nothing else to talk about.
I would also imagine that this is also a bipartisan issue. This is something Democrats and Republicans both would agree on, wouldn't they?
Very much so. And employer-sponsored annual family plans, I know we were just talking about health insurance costs a minute ago, the premiums are up 50% from what they were a decade ago. So when you're thinking about bankruptcy, those bankruptcy numbers, and also just the out-of-pocket premium costs for your standard plans, I mean, it is such a heavy lift for families. So to be paying that and to be saddled with that sort of financial burden and not have the ability to know prices up front and be saddled with this bill that comes in the mail that you may not have an opportunity to negotiate down. I mean, it's really, really a mess, and we really need a better system or a system in place that holds these providers accountable for actual price tags.
Speaking of a system,